Yes, osteoarthritis. The word osteoarthritis is an misnomer because we know that it means inflammation, but in this condition there is no inflammation. So we use a new term called as osteoarthrosis. It has two types, the primary and secondary. In the primary, the articular degeneration is without any underlying cause. It may be due to the age or stress. In secondary, it is because of the consequence of pre existing abnormalities like rheumatoid arthritis, tuberculosis, or septic arthritis. Means in this we can say there is present a pre abnormality and therefore the patient is suffering with osteoarthritis. In the pathogenesis, there is progressive softening and disintegration of articular cartilage. It is associated with new growth of articular and bone at the joint. The earliest change is increase in the content of water of the cartilage. This is the first microscopic change. The most common precursor of primary osteoarthritis is the stress. The first sign or the earliest sign is the pain. The most common distressing symptom is the loss of function. There is present of genovarum. Proximal phalangeal joint bulge is seen and it is called as Bouchard's node. And the distal pharyngeal joint bulge is seen, it is known as Haberdin node. Here in the image, we can see this is a condition of absolutely normal. In the genovarum, the thighs comes outward, and in the genovalgum, this thigh will goes inward. And here we can see the proximal joint. We can find Bouchard's node. In the distal joint, we can find Haberdin node. So, yes, this is proximal joint. This is a distal joint. Proximal joint, we have Bouchard's node. Distal joint, we have Haberdin nodes. Let's see some differential diagnosis with the rheumatoid arthritis. In this, there is only genovalgum. There is no genovarum. In this, there is no involvement of distal pharyngeal joint. Only the proximal pharyngeal joints are involved. Now let's see X-ray. X-ray features. There is asymmetrical narrowing of the joint space. Means only one side of the joint space has been decreased. For example, if you see here the space is equal same, but here the space has been decreased. This is the asymmetry. We can find sclerosis of subchondral bone. Here the sclerosis means this whitish area. Let me change the pen. Here the sclerosis means this whitish layer. It is called the sclerosis. And we can find osteophytes at the margin. We can find osteophytes at the joint margins. These are the osteophytes. at the joint margins. This this is the osteophyte. This is the osteophyte. Next comes to the treatment. In treatment we have surgical and non-surgical treatment. In this, first we have to educate the patient that the patient should not do unnecessarily knee movement, and he should practice the quadriceps strengthening exercise. Quadriceps are the thigh muscles, anterior thigh muscles, so you have to perform some exercises as shown in this figure. Next, you have to do some physical therapy like hot fermentation, and he have to wear some gadgets like this, and he should go weight loss, and we have to give NSAIDs, and we have to give intra-articular injections like steroids. Intra-articular means we have to give in the joints. See, this is the joint. Surgical treatment includes high tibial osteotomy. In this, the small part of tibia is cut, and it is fixed with some external applicants so that the space is increased. Next, total knee arthroplasty. It is done in the severe cases. We take the knee anteriorly and we place artificial things. This is the total knee arthroplasty. This was about the osteoarthritis. Okay, thank you.